Hello everybody, I'm here today to talk to you about rehabilitation and physical therapy in regards to hyperbaric oxygen. I've been practicing rehabilitation physical therapy since 2006, and it really was a life-changing experience for me. We've been using every modality known to rehab, but the one modality that has added the broadest scope to my practice of rehabilitation has been hyperbaric oxygen. First of all, it reduces edema and swelling just by the nature of the pressure inside the chamber, and an enhanced range of motion. We combine that with our standard protocol of rehabilitation post-surgically. It also reduces inflammation. So at the same time it reduces edema and the swelling, it reduces that inflammatory process inside the joint, also enhancing range of motion. Another really important aspect of HBOT in rehab is it reduces ischemia, or the inability for blood to get to a particular part of a tissue. We get oxygen to enhance cell function without blood supply due to the plasma bridge that happens inside a chamber. In addition, there's angiogenesis, which enhances blood formation inside the joints postoperatively to enhance rehabilitation. There's something that happens inside the chamber with a nitrogen molecule and an oxygen molecule that truly, in my opinion, makes a big difference in so many of our rehab patients. Creating nitric oxide. This is one oxygen and one nitrogen molecule, and this molecule increases circulation when you're in the chamber under pressure. It signals an undifferentiated hematologous stem cell to come out of the bone marrow. These hematogenic undifferentiated stem cells are part of what helps us heal. Inside the chamber, you increase the volume of these cells eightfold. These cells circulate inside the blood, looking for areas of inflammation. When they find that area of inflammation, they engraft into that inflamed tissue and morph into the cell type that is diseased. What happens inside the chamber due to this nitric oxide cascade, so to speak, is an increase of these potentially healing CD34 undifferentiated hematogenic stem cells. So aside from decreasing edema, from decreasing swelling, from improving ischemic tissue problems, from the perspective of increasing angiogenesis, it has this potentiating effect on our stem cells. When I met Jack, he was attacked by a dog and became paralyzed in his back end. He had an implant in his spine at L2, L3, and was given a fairly grave prognosis, but it wasn't until we actually put him into the chamber, decreasing the edema and pressure around his cord, reducing the inflammation around his spinal column, that made a profound difference in this dog. His mom actually told me that she felt that it was his miracle cure.
Jack is a Yorkshire Terrier. He's 8 years old. I'm from New York, Long Island, and we were displaced by the storm. The hotels were allowing people to bring their dogs in as a matter of courtesy. And this pit bull came, and he just picked him up out of his stroller and mauled him. Jack's back was broken, and there were open lacerations, one large one on his leg. And we were fortunate enough to have gone to a place where there was a spinal surgeon on call, and within a couple of hours of the injury, he was having a spinal surgery. At first, I was to be content that Jack was alive, but in that 2-week time, I spent it researching. I knew he was going to survive because that's Jack. He's a spunky little guy. I Googled paralyzed dogs and how to treat them, and I came up with Calusa Veterinary Hospital in Boca Raton. When I came in here and I saw this tiny little chamber, it was remarkable to me that this sophisticated machine would be here. He was injured January 9th, and he had his first HBOT treatment. I think it was 25 days post-injury. And for an hour and a half, he just had a quiet rest inside the chamber. I brought him home and he slept for 12 hours. Actually, he was getting the first really good sleep he had had in a very long time. And by the third or fourth treatment, I noticed that the open wound on his leg had almost completely closed. And I'd say by the fifth or sixth treatment, his energy level had increased. By the 10th treatment, I was almost ready to ask for a sedative. I told Dr. Turkel that HBOT was like putting Jack on crack because I could not contain him and his energy. He's still very fragile, but his general health has improved so tremendously. And he went from barely standing to walking, and we went right into physical therapy here. But I think under these circumstances, he's got the best shot at staying healthy. I think he's going to have a very full life, and we're going to enjoy each other's company for a long time.
I really want to emphasize the effect that hyperbaric oxygen has on physical therapy and rehabilitation. I think you're going to have much better end results, much better maximum medical recovery. Use rehab with almost every surgery and or not surgery, but also use hyperbaric oxygen in regards to your rehabilitation. It is a modality that's going to make big differences in your outcome. Thank you very much.